Hi everybody, I'm back with another video. This time is going to be slightly different than the other videos I've made though. I had the opportunity to talk with a couple of healthcare workers in England, living in the UK, and I kind of spun that into an idea of having a bunch of different conversations. So this will be a conversation series. I'm tentatively calling it COVID Conversations with Steve Jones. It was very interesting talking to these two healthcare workers. I hope you think so as well. We go through a bunch of different stuff. Spoiler alert, one of them caught COVID-19. We go through their experience with that. We go through their healthcare system. We go through how they're dealing with this in nursing homes, as well as different testing in the UK versus in Canada, and the antibody testing as well, and a few other things. So hopefully you guys enjoy this conversation as much as I did. I found it very informative and quite interesting to compare and contrast the differences in our different countries. So enjoy. Hello everyone, my name is Steve Jones. I'm a healthcare worker in BC, Canada, and today I am joined by Rachel and David, two healthcare workers working in the UK, working in England. So I'm very excited to be able to hear their experience with everything that's been going on. Rachel, we first, I believe, kind of ran into each other through a Facebook group that you're running. It's called Frontline Healthcare Professionals Fighting COVID-19. So very good job with that. I'm always happy to see people going the extra mile and trying to help everyone out. So thank you for doing your part. And I believe, Rachel, you are now helping with setting up people that are disabled, but you did used to work as an emergency nurse.
That's right.
Yeah. Excellent. And then David, right now you're a registered psychiatric nurse working in a nursing home?
Yeah.
All right, great. So first, before we get into the nitty-gritty of everything, I'd like to ask you both how you're both kind of feeling, how you're both doing from a scale from 1 to 10, 1 being, you know, calmly dealing and waiting things out and anticipating when you can hug your loved ones again, and 10 being, you know, doing some hoarding of some toilet paper and panic buying.
We didn't do that.
Well, do you know what? To be fair, when we lived in Canada, I've always bought bulk. And
Yeah.
when we lived in Dawson Creek in northern BC, I had a walk-in pantry down in the basement, and I always had extra supplies. That's just how I roll.
Fair enough. So you already had all the toilet paper you needed.
Yeah.
So what are you in? 1 or 2 or 3, 4, 5, 6, 7, 8?
I'd say 9 or whatever. You know, I'm going back to work on Tuesday. I think we have a good balanced perspective on what's going on.
Yeah.
Over here, and I think that helps to wrap your head around this kind of stuff. You know, I think for a lot of people who perhaps don't critically think, it leaves them in a lot more of a quandary, doesn't it, with a lot of unanswered questions and fear. You know?
Yeah, no, exactly. That's kind of what a lot of people have been dealing with is a lot of fear. But yeah, I'm kind of in the same boat as I just try to educate myself as best that I can, protect myself the best that I can, and as long as I know I'm educated and I'm doing the right things as far as anyone can tell, it is what it is. So I'm fairly calm, even though it's should be a fairly stressful situation, and it is.
We don't want to be minimalistic, but neither do we or are we catastrophic.
Exactly.
In our perceptions and our of the matter.
Yeah.
Yeah.
You've got to have a level head about it, haven't you?
Yeah, exactly. Well, good. So Rachel, we initially touched base a few weeks back, actually, and we were going to be doing a talk back then, but some kind of unforeseen circumstances kind of prevented that from happening. So why don't you get into it?
Now you get to see me. Yeah. You're blessed.
Yes, you are the unforeseen circumstance. But yeah, why don't you tell us what your experience was there, David?
Oh, me. Basically, I was at work, and amongst my various tasks I do, one of the healthcare workers alerted me to one of the residents who was seemingly unwell, whatever that was.
Mhm.
So I just, excuse me, went to his room, took his vital signs, and he coughed in my face.
Mm.
And I sent him to hospital that night. And when I called up the next day to make inquiry about his well-being, they told me that he tested positive for COVID-19. And then it wasn't until about, I think it was about 2 days after that, where I started to have an uncontrollable dry cough to the point where if I didn't breathe in, I was going to pass out.
That was horrible.
Wow.
So, and that was on the 8th of April. And
That fever as well.
Yeah, 39.6 or something like that. So that evening I, excuse me, I called the 111, and basically I got a 1 week sick note. But after the week, I noticed things getting a little bit more intense.
Mm-hmm. It came and went, and came back again. It was really weird.
So I called the doctors and they gave me another 2 week note, and then a few days later it got worse again. And it was just this cough that was really bothersome. So I was taking cocodamol because it's good for the cough reflex, and lots of honey drinks just to kind of line my throat a bit.
And when did you actually get tested and get confirmed that that's what you had?
I got tested about 3 days ago.
Yeah, it was terrible with the testing.
Yeah.
It wasn't available, so.
Oh, really?
It's only recently, probably in the last week and a half, they've actually sent out on the government website that we can actually go for tests.
Yeah.
And I think they're up to 100,000 per day now.
Yeah.
I've seen that.
Yeah.
Huh.
But yet about.
But when I went, it was in a big parking lot. It was the military, and you had to have your window up, and then there was a board outside with a number on it you had to call. So I called the number, and they guide you through this cumbersome process to simply take a swab of your tonsils and your nasal passage.
Yeah, he had to actually do it himself, which is really weird because I think in other countries they're actually getting nurses to do the actual test. And from what I know, the test it goes quite far back to the back of the throat and to the back of the nose. But really, how well were you instructed?
Well, I rubbed the swabs around the tonsils like I was instructed to do, and then used the same swab, probably an inch or so up the nostril till you feel some resistance, and then put it in a bag. But the test came back 2 days later, stating
in capital letters,
not clear.
What does that mean?
Now, does not clear mean it is not wholly conclusive whether or not you have it, or does not clear mean you are not clear you have it?
Yeah.
Crazy.
Wow.
But I'm not going back to work till Tuesday, and the symptoms that I had have diminished. The cough can last for approximately 1 month, apparently.
Mm-hmm.
Yeah.
So,
crazy.
Yeah.
Well, quite the ordeal. So, were you isolating yourself from the rest of the family? Did it spread to everyone else?
I stayed in this bedroom. I stayed in this bedroom for a good 2 weeks, and I watched all of my serial killer and chef cooking shows.
Yeah, and he was weighted on hand and foot. Yeah.
Oh,
I
got text messages because we'd have text messages like, like, can I have a honey and lemon? Can I get my food now? Can you make me a cheese and pickle sandwich? I never thought out the day that I would actually meet my husband with an N95 mask, a pair of goggles, a mop,
gloves.
And I pushed him upstairs. I'm like, go, 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 go. And I got the kids in the other rooms, hadn't I? Oh yeah, it was quite the ordeal. Yeah, it was pretty scary actually.
Well, I was that bored. I bought a pair of binoculars because we've got a lovely view out of our bedroom window of the English countryside, beautiful hills and all that. So I thought, I'm going to buy a pair of binoculars. At least I can look at the fields, look at the cows, and
hopefully not go stir crazy
and stuff like that.
Crazy. So you guys managed to not get the rest of the family sick then?
Seems that way.
Well, we don't know, but we think the kids might have already had it because they actually, before the lockdown, which was probably about 5 weeks ago now.
23rd of March, I think that was,
The week before that, they were ill as well. They'd been at school and they ended up being off for about 2 weeks, but Jordan was sick for probably about 6 weeks. She was really sick. I actually thought she'd got pneumonia at one point. So she ended up getting antibiotics and it cleared it up. And Lucas had it for probably 2 weeks maybe, but he wasn't as bad. But they all got fevers and they've all had coughs. The only person who hasn't had a fever and a cough is me. Yeah.
There's so much speculation and lack of certainty with respect to the origins of this particular thing. And, there's so much conflicting views and opinions, and it has been said that this came out a number of months ago.
Yeah. Well, it's funny because it was in October. I was actually working in the A&E then, the Accident and Emergency Department. And the amount of people that were coming in at that time, especially children, and a lot of elderly with a cough and a fever.
Interesting. Yeah.
And I was around all of them. So I was nursing all of them, but I had no mask or anything like PPE because you just assume, they've got pneumonia. And it kept coming, pneumonia, chest infection, pneumonia. And then I came down with a really, really bad cough and a fever. And I was probably ill for a good 4 weeks again with that fever and the cough. So I'm wondering if I actually had it back then, like around about November time. But they're saying they're not sure, are they?
It's not outside the realms of possibility, is it, at all?
Yeah, so because it is weird that everybody else has had it, but I haven't.
Well, it's not outside the realms of possibility, given that it's also been stated that this evolved in Wuhan, whether or not it was, back in September.
Yeah, so who knows? I might have already been in contact with it being in A&E.
But yet there's a doctor in the States said it was cultivated back in 2015 down in the States, and money was put into it, and the powers that be in the US government invested a lot of money in it, and they metamorphosed this, basic COVID-19 thing into something else through genetic modification. So, apparently with HIV and something else, and then we turned it into a bit of a monster.
Yeah, no, there's a lot of unknowns that it's just going to keep on getting.
It's confusing, isn't it?
Layers.
So that people don't know what to believe.
Yeah.
Huh. Interesting. So let's go back to when you were working. So when this patient coughed in your face, did you? I guess you just didn't think to have PPE on at that point.
Right, he had no symptoms.
Yeah,
it was just a case of, Dave, this old guy's not doing too good. Do you mind having a look?
Okay.
Yeah. Warned. But then a lot of the nurses and carers aren't taking it very seriously. Back then they weren't taking it very seriously anyway.
Right.
They were laughing about it, some of them, and thinking it was a bit of a joke.
Yeah.
So
not a big deal, huh?
And the PPE you had was a paper mask. It wasn't even the proper stuff. It was
all
like
out of date.
mask. Yeah. All out of date. Yeah. So.
Crazy. So you've been off work for a while now, but do you know, have they ramped up the measures in the nursing homes, or is it still fairly lax?
I've no idea. I truly don't know. I hope so.
Yeah.
But as of a few weeks ago, there was little to not
very little
being done.
I mean, even when we used tympanic thermometers, there wasn't even the covers for them.
Really?
So the minimal supply that we had, I would put one in each patient room.
Yeah.
And use the same one.
Same one. Huh.
So hopefully, but they said I think it was said that they were going to try and get more PPE. They said they had the PPE available, but it just wasn't getting through to the right places. And then what was happening was they were saying that the PPE they had was being diverted to the NHS because they felt that they needed it more. But then they were forgetting about like the nursing homes and the residential homes
private sector,
that needed it as well. So I think what one person said was that they'd ordered it and then it had been diverted. And then a similar thing was said to Scotland as well. Scotland had ordered a bunch of PPE and it had been diverted to all the hospitals. So
we were getting a plane load in from the Turkish military last week.
Really?
Yeah.
Crazy.
It's just interesting though when you look at our seemingly sophisticated society and the progress of humankind, that, with all of the policies and procedures around disaster preparedness, etc., that we don't have our metaphorical ducks in a row with respect to personal protective equipment.
Yeah.
Right. Really?
Yeah. Yeah, and that's
That,
pretty much worldwide. It seems to be a
yeah,
problem. Some areas worse than others, but yeah, it seems to be a struggle for pretty much everyone. Like a lot of the stuff has been outsourced, and we didn't have adequate stockpiles available, and it's just yeah, everyone's in a scramble at this point.
The
But I'm
same
kind
way
of
you are as well.
yeah. Well, for us, it hasn't. We haven't actually been hit all that bad, and I don't want to say we haven't been hit, but like it
Yeah.
hasn't been nearly as bad as I kind of anticipated. So I consider us very fortunate where we are right now that like there hasn't been any shortages in PPE, and as far as I know, the way it's being handled in the nursing homes is being taken fairly seriously. Like I've got a grandma that's in an elderly care facility, and for I don't even know how long, it's been, at least a few weeks to maybe even a month. Like even her daughter wasn't able to come in and
right,
visit. They
yeah,
Yeah.
did grocery shopping. She dropped the stuff off at the door. The workers there took it in, wiped it all down, and then transferred that over. And as well, I don't know how many other places are doing this, but I think it was in BC, at least they started as soon as they had one person in a nursing home that was confirmed or that was suspected to be having COVID-19. They diverted a bunch of different employees and sent like what they call a SWAT team over to the nursing homes. They like pretty much lock them down and make sure that they're doing the proper hand washing, that everyone is on the same page with everything. And yeah, we've done a really good job as far as I can tell from especially with the nursing homes,
that's good, yeah.
containing it really, really well. So yeah, no, hopefully when you get back to work, that's what you're going into, but we'll see.
Someone once said, the optimist may be wrong, but he has a lot more fun than the pessimist.
There you go. Huh. So,
Yeah.
so you guys, you're going back to work pretty soon. And as far as the testing goes, like you said earlier, that you've been doing, I think your country's up to over 100,000 tests being done per day now.
Allegedly, yeah.
Yeah, yeah,
Who knows? Yeah.
yeah. So has it been opened up to like pretty much anyone that wants the test, anyone that's symptomatic, or do you know how available it is for
You
people?
fought, didn't you? You fought to get a
Yeah.
test. Like
Really? Even
we had
you
to
working
push
in a
for it.
nursing home, wow.
I think it only happened though because new legislation came out from the government. It was a drive only in the last week
Yeah. Just for
to
key workers.
for key workers and people working in care homes, particularly
Yeah.
to undergo testing because it was eventually recognised that they were a forgotten people group. You know, whether it's
They weren't even adding the numbers of the elderly people in the nursing homes onto our statistics.
the deaths.
So the deaths that we
Oh.
were getting, like where it said 900 a day, there was even more because they weren't adding on the elderly people, which they've started doing now.
Yeah.
Yeah, and then we were hearing that they didn't even have to write. Some of the doctors were told you don't even have to write COVID-19 on the death certificate. You can write something else. So even that, like, you wonder how kind of like realistic them statistics are.
See, I've heard the opposite. I've heard people have died. They haven't nothing's been verified, and it's been on the death certificate COVID-19.
They just put COVID-19.
So
yeah.
Again, there might be a cluster of symptoms that led,
Yeah.
or that were in and around that person's death that made it highly suspected that.
Yeah. Yeah.
Yeah, no, that's crazy. Well, even here, they have opened up the testing a lot more, but at the starting, it was restricted to healthcare professionals, but they did always have the elderly, the nursing homes, and that type of stuff included in the people that were able to get the test because they're such a vulnerable population that like that's who you have to protect. So more the general population can get it here now. I think you just need to go through your family doctor, and then if they deem it necessary, then go for it. But before, it was pretty much just healthcare workers, nursing home professionals, and anyone that's coming into hospital that needs to kind of stay in hospital. You kind of want to have them tested as well. So yeah, it's been restricted for a lot of people everywhere. But yeah, it seems like it's just should have been opened up a lot more than it was. I don't know if that was a supply and demand problem or if it was just a capacity of doing the tests or what. But yeah, it should have been ramped up a lot sooner.
Here it was a government organisation. They just didn't organise it properly. Like they needed to be onto things a lot quicker. And I think for like us, from what I've seen, a lot of people didn't take it seriously. They just thought, oh, it's another hoax. It'll just blow over, and oh, it's all elderly people in China that are getting sick, and it'll be fine. So like a lot of people, I think, even our government, I don't think they took it that seriously until it actually really hit. And then it was like, oh, we have really got something on our hands. And then Boris got sick.
Yeah, that was a whoa.
It's like, okay then. And I remember seeing him on the, he was on like a little Zoom thing, and he looked terrible. Like, and he was like breathing like this as he was talking, and like, yeah, he landed in hospital for 2 weeks. So he's only just come back.
One of the difficulties that I perceive and personally experience is the whole ethical conflict in and around being at work, having actual or suspected symptoms, and staff perhaps making comments like, well, you know, I can't afford to go off, I can't afford not to be paid. And although I appreciate that, you know, it's tricky ground, isn't it? And you know, we've got a responsibility and all that.
Yeah, you've got a duty of care, right?
So then, you know, I know a comment was said about, well, you know, we've all just pulled through it together and we've just soldiered through. And I thought, well, look at that vocabulary. What does that mean, first of all? And secondly, that then draws attention to people like me who have, you know, wrestled with the ethical dilemma and responded effectively and went off. But then the good guy becomes the bad guy, perhaps, for going off and not being a team player or not soldiering through.
Yeah, well, you got to do what you got to do and what you feel is right. And like, even I don't know if you've if you heard about what happened with me, but I actually got tested myself as well. But for me, it was like I work in the hospital, so I'm direct patient care every day. So for me, I just had developed a new cough, and that was it. No other symptoms, just a new cough. And they sent me home from work, made me get tested that day, and I couldn't come back to work until I got the results back. So, and yes, they do shove that thing way back.
Doesn't sound very nice at all.
Not
That's
very
nice.
pleasant, no.
But it will go.
It's all right.
But no, my results came back within, it was just over 24 hours, and they told me I was not infected and get back to work.
So off you go.
Yeah. So
but that's really good though that they actually did that. They had a process that they followed.
Right.
Whereas here they have not got that process. There's no policy. There's no procedures around it. Nobody knows what they're doing. It's all over the place, isn't it?
I believe the most appropriate expression would be a gong show.
It's just every man for himself out there. Right?
Pretty much. Yeah.
That's crazy. Yeah, no, it's interesting to see how different places have been responding as well. Like, and I know neither one of you work in the hospitals right now, but I can't remember but even a few weeks ago, even a month ago in the hospital, they've made anyone that has any sort of direct patient care, everyone's wearing a mask, you're wearing goggles the whole time, like your whole shift.
Yeah, I don't think that's happening here, from what I know.
Yeah, it's not.
It's more that if there's somebody's got that, you know, like they know they've got it, or they come in with symptoms, then they'll put the PPE on. But for everybody else, I think it's generally.
I'm actually going to correct myself there.
And apron.
I think it's not happening where I work, but again, in England, there's so many different counties, and there's different health authorities. There's maybe, for example, we're in Staffordshire. There's North Staffordshire Healthcare, South Staffordshire Healthcare, and if you get 50 counties in England, you know, with different funding pots and all of that, there's got to be subcultural differences within the larger culture with respect to money and PPE and all of that.
Yeah, exactly. Well, and they
to make a broad generalization wouldn't be fair with it.
Yeah, fair enough. And it could be very well linked with the availability of the PPE. Like, we could just have more of it available here. So, hey, let's just be extra careful and everyone wears this. They've been doing a questionnaire for all of the patients that come to the hospital as well, and no visitors either. Well, very, very limited visitors. But they did a questionnaire for anyone that comes into the hospital, just asking if you've had a recent fever, cough, or anything like that. And if you do, here's a mask. So even the people coming into the hospital, and everyone gets sanitized, hand sanitizer as you walk in the door, and so I'm fairly happy with the way that we've responded. Hopefully that's made a big impact, and seems like it has, because like I say, it hasn't gotten nearly as bad as I anticipated it, and hopefully it'll stay the same. So
Yeah. I
yeah.
think they definitely locked down the hospitals, whereas you can't go in, like if you've got relatives in there. My aunt actually had a stroke about 2 weeks ago. She ended up getting a right-sided stroke. Luckily, she got in there and they gave her the stuff and she's completely back to normal now. But when she got there, it was basically she went into the hospital and the family weren't allowed in. It was,
Yeah.
we call and you'll find out what's going on. So they have
Yeah.
locked down the hospitals for visitors and things like that, even in emergency
Their care
situations.
home's been like that for the last 6 weeks, no visitors, anything like that.
Yeah, which is good.
Yeah.
And we're all still on lockdown.
Harm reduction, though.
Yeah.
Yeah.
We have no idea when it's going to end.
No, I know.
Yeah, well, I heard that one of the ways that we're hopefully going to start opening things up and for it to maybe get better is to do some mass antibody testing. That way you can see if people have had it in the past and gotten over it without knowing it, or just thought it was something mild or whatever. Because like we say, we're not testing everyone, especially mild cases and stuff like that. So who knows how much it's actually out there. But I was reading an article about the UK actually purchasing, this would have been a couple weeks back, purchasing about $20 million worth of antibody testing. And then they did their own testing, quality control, and found out that we can't use those. They're not, they're
waste
not
of
good
money.
enough. So yeah, they had to pretty much not get used. So I'm kind of conflicted between, like, do we push these tests out as fast as we can, but you don't know if they're actually effective and if they're giving you real numbers. So it's kind of a struggle between the two. So yeah, I'm guessing you heard about that story, did you?
Yes. Yeah, I've followed the news quite a lot, really. I think more than I've ever followed the news before.
Yeah.
I mean, it's like every morning, it's like, what's happening? Midday, like how many deaths? Like, because you want to know what's going on, if it's going down or if it's going back up again. And yeah, so definitely saw that that's what the plan was to have these antibody tests and then start getting people back. But now they're saying that they want, they're on about, there were an estimated date of about the 26th of May that they were going to get us off lockdown. But the way that was going to look was with the commuters going back, like they're going to test all the commuters, people who are commuting, and then they start slowly getting like factories, and their temperatures as well. Before they get on trains and buses and things like that. But not everybody has a temperature though, so it's like, but they do want them all to get checked before they go back, so they know that they haven't got symptoms. But so it would be like factories going back and necessary shops, I think they said, wasn't it?
Yeah. I think in the back of a lot of people's minds, I mentioned earlier, we don't want to minimise, but neither do we want to be catastrophic. But I know in the back of a lot of people's minds are, something doesn't seem quite right with this whole thing. They seem to be very intent upon the lockdown, stay indoors, yet paradoxically it's go out there, lack of PPE and all the rest of it. And, when you look at wider political agendas, that are, quite complex for some, but when you think of the cashless society that the government want, we're not handling cash. I've done it myself where I'm not even using a PIN number now, I'm doing the scan of the card. So there's a systematic deconstruction of cash and the psychology around handling of cash and dealing with cash, and the cultivation of a new psychology to, follow, EFTPOS, electronic funds transfer at point of sale.
Yeah, yeah, no, it's going to be very interesting to see
Uh-huh.
what changes stick around and
Yeah.
what's going to go back to normal. But yeah, there's going to be a lot of changes.
Oh, a lot. Yeah.
Yeah, yeah,
Definitely.
and well, just like with everything, there's always going to be bad actors out there. There's going to be bad business people, bad governments trying to take advantage of whatever they can at this point. So it's going to be very interesting to see what the outcome is of all of it. But yeah, it's something that just happens no matter what happens, and with a situation like this that's never really happened in anyone's lifetimes, like some people are looking at it as a big opportunity to do things that they wouldn't normally be able to do,
Right.
and
Yeah.
not all of those are good
Capitalize upon the
things.
moment.
Yeah, so some people don't have the let's all get together and get through this together mentality. It's all about
Yeah.
them still, even though the whole world is suffering.
Yeah.
So
Yeah.
anyways, I think there's one other thing I wanted to discuss. You mentioned that you had just moved. Was it moved back to the UK from Canada?
Back in
So
May last year.
back in May.
Yeah.
So I was just
It's been
interested
crazy.
on your thoughts about the timing that you had with that. Are you happy you've gone back over there, or maybe you wanted
Definitely.
to?
I miss Canada. I
Yeah,
miss
me
my
too. Yeah.
F-150. You know, I
Yeah.
miss my money. I miss my house, and I miss the wildlife, and I miss Walmart apple pies.
And the double pay, because nurses over here get paid half the pay of what they do in
Yeah.
Canada.
Oh,
But
really?
Yeah.
yeah, but it's family, right? Like we just felt for the last few years of being in Canada that my dad was getting sick, and like we were missing family. We weren't able to see them, and it was just more of a pull, wasn't it,
Yeah.
to come back, because both of our parents are getting older and getting more kind of things wrong.
Hmm.
So I think for that reason we decided to come back, and plus our kids as well, having their grandparents and aunts and uncles and cousins, and that it's just, having that wider family is really good for them growing up too.
Yeah.
So we made a decision to come back, and it was really quick, wasn't it? We'd thought about it for a long
Well, we
time.
lived in Calgary
Yeah.
4 years, and we were talking about it in Calgary and all that.
Yeah, and then when it did happen, it happened quick. It was like we were like, let's just put the house on the market in February.
I didn't tell her. I was at work one day, called the real estate folks, got it on the market. The next day, it sold.
Dawson Creek, BC, which is unheard of. We
Wow.
actually got a photo taken in the Dawson Creek paper because Arlene
Alan
Dorowski,
Dorowski,
yeah, she said, in all the years I've worked here, which is about 40 years, I've never seen a house sell this quick. And we were like, we knew it would sell
We
because
done
we
it
knew
up
it
good.
was right to go back.
We done it up good.
Yeah, but we knew it was the right timing and everything fell into place. And thank God we did, because if we hadn't, we would have been over in Canada and we wouldn't have been able to come back.
At least we would have had Walmart apple pie.
Yeah.
Yeah, yeah.
Goodness knows what would happen with flights and all of that. Like, who knows how the world's going to change from
Excuse me.
this. So
Yeah, or
I think it was
when or if you would have moved if the timing
Yeah.
hadn't happened like
Well,
that.
we
Yeah.
have a care worker in our establishment who is English and immigrated to Australia, and periodically comes over to see family, and whilst he's over here will work. And yeah, she got a little bit of a shock. You know, you can't go back.
yeah, it's just
But thankfully, she's
Back
got
there.
family and all that here,
yeah,
so it's all right.
yeah.
But yeah, Canada, 50% of British people that go to Canada, the States, Australia, 50% go back home. We assimilate, we do really well, but you can only assimilate so far. And the heart, there's that little piece of the heart, isn't there? You know, that hangs for home.
But we still love Canada
Oh
and
God, yeah.
miss a lot about it. We've got a lot of friends in Dawson Creek and in Calgary as well. And yeah, you miss the quality of life as well, because it's not the same here, is it? But,
No pierogies.
yeah.
Yeah. All those
Tim
little
Hortons
things you
coffee.
miss. Hey, yeah.
Timmy's double.
And the donuts. Yeah, and the donuts. Yeah. And
Oh.
yeah. But it was right though to come back.
Well, that is good. Yeah, I'm glad you guys did make it back there. It's good timing, but also a little ironic. You go home to be closer to family, and then
I know.
everything gets locked down, and you're like, well, you can't see your family now.
And they only
The
live
2
a
minutes
couple of
down
blocks
the
away.
road.
They're only a few
really?
blocks away.
Well, we keep breaking them. They keep coming to the end of the driveway, and they're like, "Hi." When Dave was sick, they ended up doing all our shopping for us, which was kind of ironic because we're like, "We've come back to be here for you, not you
Yeah.
come back to be here for us."
Yeah.
So yeah, they were bringing us all shopping, and they did really good for us, didn't they? For the 2 weeks, they shopped for us. Yeah, so that was good.
Wow. Well, excellent. Well, is there anything else you guys wanted to talk about? I think we did. We talked about a whole gambit of things, and it's been very
Yeah.
interesting and very enlightening to hear what things are going on where you are versus how we've been handling it here.
Yeah, yeah. It makes me want to be in Canada now because yours is not so bad.
Well, not so bad where I am. In some areas, like in Quebec, I think is being hit the worst.
Oh,
I don't have much experience there, but yeah, still, it's at the very least, it's less densely populated.
right.
So
Right.
having people more spread out, like that's got to have an effect on how easily it is for everything to spread. So yeah,
My immediate thoughts were like Toronto, Vancouver
Yeah,
yeah,
would be harder hit.
yeah.
yeah. But I don't know. I don't know what it's been, but we seem to be handling it fairly well. We haven't been inundated, and our capacity in the hospitals have been actually fairly good. So again, hoping that trend stays, and we never will face that situation. But yeah, only time will tell.
Excuse me, one thing I did wonder was, and I never asked Todd, up in Dawson Creek, you know, when you look at the temperature, I mean, up in Dawson Creek, you know, we would get, you know, minus 36 for a couple of weeks. And it'd be interesting to know if there was any data about the effects of temperature, sub-zero temperatures upon viral infections such as
Yeah.
COVID-19,
I don't know.
you know?
Yeah, yeah. Well, I would imagine it would be harder for it to spread at the very least, or for it
Right.
to survive on surfaces at temperatures like that.
Up there we to plug our vehicles in,
Yeah, yeah.
you
So
know?
out there, yeah, that probably would prevent the spread a good amount, and you're probably
Yeah.
not
Yeah.
in close proximity to people, and you're all covered up for the most part, anyways, because you're cold.
Right. Yeah.
So that's your built-in PPE for them.
Yeah.
Just wear it to work, you'll be fine.
There you go. Awesome. Well, thank you guys very much for joining me. I really appreciate it. Hopefully, we'll stay in touch, and yeah,
totally.
don't be strangers.
Yeah, it's really nice to meet you.
You too,
Yeah,
mate,
you
yeah.
too. You too. Put a face to the name.
Yeah.
Right. You guys take care. We'll talk to you later.
All right, take care, see ya.
Bye.
Bye.